Hello, friends. How are you? Welcome to our program. With me today is Dr. Kaira Anthony, uh, one of the best embryologists we have in the country. And we are here to discuss male infertility. For quite many years, fertility conversations have really focused on women. Very little has been done about men. And also the men seeking behavior is a little bit low compared to the people who come to the fertility clinics. So we are here to basically bust a few myths. Can a man be healthy and be infertile? Can a man be sexually active and be fertile? So today we are basically focusing on male infertility. And we want to discuss it in the simplest forms to help you, our audience, understand it. So with me is Dr. Kaira Anthony, as I had said.
Yes.
Please introduce yourself to our guest.
Thank you very much, Joseph, for having me on your channel again. I'm always happy to be here and share information and discuss some of the things that really bother most of our members of our audience a lot.
And we are always glad to have you around.
Thank you.
So first things first, Doc. Is infertility a woman's problem alone?
No, infertility is a couple's problem.
Okay.
Yes.
And what do the men account for?
So, for a couple to have a child,
Yes.
you need sperm from the man
Okay.
and eggs from the lady.
Yes.
And the uterus to carry the conceptus
Mm.
until 9 months are done and it is delivered.
Yes.
So ideally it's a 50-50 contribution. And in fact, it is so strange that even among couples that are looking for children that are having challenges, 50% of the time it is a man's problem, 50% of the time it is a woman's problem. Meaning there is literally a 50-50 contribution to the opportunity to actually have a child or start a family. Yes.
So when we say that a man is fertile, what does that really mean?
When we say that a man is fertile, we basically mean that he has had a child with his female partner. That's it. A man who has had a child with his female partner is considered fertile. In terms of laboratory diagnosis, the assumption is that if you are able to make your partner pregnant, then you have making normal sperm. The sperm is enough. The sperms are moving well. The sperms are able to fertilize the eggs, and the quality is good. Remember that just having sperm is not enough. It has to be enough. It has to be of normal shape. It has to be moving well and able to fertilize the egg.
Okay.
Yes.
So what is sperm? Is semen the same as sperm?
No, semen is a vehicle. A vehicle is like the car that you have at home, you know? And then you would say you are like the sperm. The vehicle is there to enable you to reach work, go to places. But without you, the vehicle cannot. Of course, there are semi-autonomous vehicles these days, but not getting into that. The vehicle is important, but it's just as important as the driver. So having semen doesn't mean that you have sperm.
So
But you cannot have sperm without semen.
Okay.
Yes.
So having semen doesn't mean that you have sperm.
Yes. But all those who have sperm that is capable of fertilizing eggs have semen, because semen is like the sperm is literally suspended in the sperm cells are suspended in the semen.
The semen.
Yes.
Okay. Yeah. So the assumption out there is that people think that if a man has normal erections, they have a strong desire for sex, their libido is good, they can go 2-3 rounds with normal sexual fertility. They think that is enough to say the man is fertile. Is it true?
Actually, that is another misconception.
Yes.
And I wouldn't think that it's so far-fetched, because in a society that actually we we're actually born in this kind of society,
Yes.
it's quite very common for people to believe that virility is the same as masculinity.
Yes.
How good of a man are you kind of compares to how fertile you are. Because even when people are looking for partners, they're looking for what they consider as handsome men,
Yes.
you know, with all the attributes, the right height, the right skin tone, the right physical. And we assume that means that his person is virile. Virile meaning, meaning that they have the competent sperm
Yes.
to be able to make a woman pregnant. Unfortunately, it's not the same.
Okay.
Erections don't mean that you're fertile.
Okay.
Although lack of erections might make you infertile.
Yes. Yes. Yes.
Lack of libido doesn't mean that you're fertile.
Okay.
Although low libido may secondarily make it difficult for you to have kids if you are not having sex frequently. Ejaculation or production of semen is not proof that you're fertile.
Wow.
Because semen is not sperm.
Wow.
Although sperms are suspended in semen.
Yes. Yes.
And having good semen volume doesn't necessarily mean that there is sperm.
Okay.
Yes.
So what you're trying to say is that performance in the bedroom is totally different from reproduction.
Yes, the accountability for a man in terms of the fertile arena is the ability to make a woman pregnant. Okay. And so sexual prowess has no correlation, no association with fertility.
Okay.
Surprisingly, that is true.
Okay.
Yes.
So what are the most common reasons why would a man have infertility problems? What are the common reasons, or what are the common causes?
Yeah, so
starting with maybe lifestyle factors.
Yeah, so lifestyle is just very key. And why I really like very much to focus on lifestyle is these are things that we can actually change.
Yes.
Things that you can modify and probably could improve your chances of getting your partner pregnant. So we have things like smoking. Okay. There's nothing like excessive smoking. Smoking is just smoking. If you are smoking anything, could be cigarettes, could be cat, could be marijuana, could be shisha, anything. That is likely to result into challenges. We have excessive consumption of alcohol. Because alcohol, there's a qualifier there, of course, it's excessive consumption. If you are really binge drinking, taking more than maybe 3 pints a week, you're really in excess range. Okay. Obesity. Obesity is more of indirect.
Yes.
Sometimes the conditions that cause you to have excessive weight gain and not being able to control your weight also can affect how your testicles produce sperm. And that is how obesity relates. So it's not for everyone, but it's a common thing that people who have challenges with their sperm parameters are more likely to be overweight than not. Stress, also not direct, but in some people who are very sensitive to stressful conditions. Let me give you an example. In many times, women will say, after having a stressful condition, they maybe miss their periods or their periods come early.
Yes, yes.
Unfortunately, men don't have periods. So the way stress will manifest in a man is by negative variation in their sperm parameters. Recreational drugs, illicit drugs, cocaine, other drugs also have an impact. Okay. Yes. And then we have the medical causes.
Yes. Talk of the medical causes.
Yes. So these ones, they may not be so modifiable, but they're actually treatable. Okay. One of the commonest ones is having had a sexually transmitted infection. Chlamydia, gonorrhea, things like that. So these infections usually cause scarring in the ducts that move your sperm cells. So they literally just block your sperms from moving at the time when you actually ejaculate. And then we have people who have suffered from mumps. These days, the government mandates that we have the MMR vaccines, measles, mumps, and rubella.
Vaccination.
Yes. Why we have that vaccine is because mumps is one of the commonest causes. Mumps infection of causes of inability to produce sperm in adulthood. That's the only reason why mumps vaccine was introduced, because mumps was an infection you suffered from and got cured automatically.
Yes.
Yeah, but the issue is there were long-term consequences.
Mumpsitis.
Yes, mumps infection of the testis, causing inability to have make sperm cells in the future. We have men who have some hormonal problems, like you may have a tumor in your brain that's producing wrong signals to your testis. So your testis cannot really coordinate the production of sperm cells. Surgery. You may have botched hernia surgery. Hernia are these, protrusions of intestinal organs through your defects in the abdominal wall. So if you may have surgery that is botched, you may have, especially inguinal hernias in the groin region.
Yes.
You may end up having cutting down on those ducts. Then genetic causes. Yeah. There are sometimes people who are born with a genetic condition that makes it impossible for them to produce sperm. And that is the reason. Or you are born with a genetic condition where some of the internal reproductive organs that are necessary for conducting sperms from your testis to the tip of your penis when you ejaculate are absent. Yes. Okay. So we also have hormonal causes.
Yes.
The main issue with hormonal causes is the one where people do anabolic steroids or injections of testosterone or male hormones to boost their physique or masculinity.
Yes. Talk
and
about
these
that.
have a hidden kind of effect because they negatively affect how your body produces sperm. Yes.
So having really a masculine body may come with its side effects.
Yes, and it's kind of paradoxical because you are going to the gym and using all these accessories to improve your ability to impress the female gender. Unfortunately, you do get the lady of your dreams, but you're unable to get her pregnant.
Okay.
So it's very important for men to know out there that not only, you see, people think that it's what's labeled steroids. No. These gym supplements. Now people know that people fear steroids. Yes. So what they do, the protein shakes, they supplement those unregulated protein shakes with steroids. Saying creatinine, but deep down, it's not just creatinine in there.
Okay.
And so you find that as you keep taking these, you buff up, but your libido drops.
Yes.
Your testicular volume drops. And then eventually you realize you can no longer get children, despite the fact that you are actually very buff.
I want you, Doc, to emphasize on this point because the ladies may be attracted to to the six packs and everything.
Yeah.
But gym with anabolic steroids.
Yes, gym with anabolic
greatly
steroids
affect fertility.
Yeah, and that's true. And I have had so many clients with exactly that. And I usually ask a question. You go to exercise? Yes. What are you using? And they give you these supplements. And once you look at the fine print behind on the bottle, there's a thing, natural testosterone, plant-based hormone levels, natural anabolic compounds. But most of these compounds do have, because normal protein shakes, it's difficult for them to buff you up quickly. Okay. The truth is anabolic steroids cause an increase in muscular mass rapidly with exercise. You get results in a very short term. And I understand why that becomes very attractive, not just to people doing exercise, but also to those who are selling.
Yes, sure.
Yeah, because with other protein supplements, there's a lot of work that goes into those gains. Whereas there's simple workflow and rapid gains with testosterone. But unfortunately, that will destroy your chances of starting a family. Okay. So that's very important.
Talk about heat and tight clothing for men.
Now, this one is what I would say 50-50.
Yes.
Because there's a myth that tight underwear, tight clothing, excessive heat can lead to impairment or challenges in sperm production from your testis.
Yes.
Of course, this is derived from the normal way testis is produced. The reason why the male reproductive organs hang out of the body in nearly all animals, I would say nearly because, chicken don't have hanging testes.
Yes.
Not so? Or scrotum. And neither do fish, but what I'm saying is for most animals and mammals in particular, the normal temperature for sperm production requires that it's less than 37 degrees. Anything close to 37 degrees is likely to result into inability to produce sperm. That is why our bodies have evolved to push the testicles out of the body, compared to women who
Yes.
have the ovaries
Inside.
the body.
Yes.
So it's because of that assumption that our testis needs to be outside the body. So we believe that, okay, so if I wear tight underwear, what's going to happen? You know, I always see mothers saying, don't put tight underwear on my kid. You know, the kid needs to be a man and things like that. So physiologically speaking, there's a sound rationale for not wearing tight clothing. But then, when you talk about excessive heat, would you say that chefs are less likely to have children?
Maybe the gym goers, the sauna goers.
People who live in Dubai, the Sahel in North Africa,
Yes.
are less likely to have children. So I would say yes and no. What I would say about this point is that some men may unknowingly have increased sensitivity of their sperm production apparatus to excessive heat, and they don't know.
Okay.
So among the 100 men who are in conditions that cause excessive heat
Yes.
to their testicles, there may be 10 or 5% who actually have the true sensitivity.
Okay.
So of course people will say, no, what are you talking about? I go to the sauna, I have 100 children.
Yes.
But there may be,
Someone.
thank you, like these things of obesity, excessive alcohol. Not everyone
Yes, sure.
who's doing doesn't have children, but people have abnormal sensitivities that are not written on their faces.
Yes.
Neither are they written in, neither do you get that information from your parents when you are born.
Okay.
So I would say if I don't have to wear tight underwear, I will not.
Okay.
If I don't have to expose myself to excessive heat, especially around my groin region, I should not.
Okay.
Yes. I don't even think it's actually comfortable. I don't know.
Definitely. It's not comfortable.
but yeah, let's really be cautious about
A
that.
little bit cautious.
Yes.
Okay. So people talk a lot about a woman's biological clock. So my question is, do men have a biological clock? Do we hit menopause in terms of fertility?
So there's a term called andropause,
Yes.
where men also go through a rapid reproductive decline. Unfortunately for men, ours is very gradual
Okay.
and very different for every man. I would say after the age of 50, for most men, sperm quality declines.
Okay.
The rapid chances, there's a likely chance that they'll have DNA damage in their sperm cells, which can affect how they function.
Yes.
And they may take longer to make younger women pregnant or women of the same age kind of pregnant,
Yes.
which is in a 50 years, same age, probably unlikely. And also they may have poor reproductive outcomes. Older men tend to have older men with younger women tend to have those pregnancies with those younger women miscarry more often.
Often. That's true.
Yes. Which is usually secondary to DNA quality or DNA damage
Yes.
in these sperm cells. So I would say it's more of a gray. I can't say that there's that particular cliff where a man's reproductive potential just falls off. That's not there. It's more of a gradual decline. And I would say the threshold is around 50 years.
50 years.
Things start to change.
Okay.
Yes.
So talking of, we normally see mostly the women in our fertility clinics. Very few people come in as couples. But when should a man get tested?
If you were a man out there and you were in a relationship and you have a relationship with an intent to have children, meaning you're not on contraception,
Yes.
and it's been about 12 months and there's nothing, you and your partner need to go and have yourself checked. If you are a man out there and you think there is a problem, maybe you have an abnormal swelling in your scrotum, maybe you have abnormal pain in your scrotum,
Yes.
maybe you believe that your semen volume is very little, maybe you have abnormal pain in your scrotum or you don't feel like your testis is actually there, or you believe you have past some history, past coming out of your penis, pain on passing urine, pain on ejaculation, then if within 6 months you don't see children, I think you and your partner should be checked. If you're a man out there and your mother or your parents tell you that you had mumps when you were younger, and you may actually have kids, but you may be delaying to have more children, please have yourself evaluated. If you're a man out there and you've had chemotherapy for cancer or radiation therapy for cancer, regardless of whether you have children or not, you should have yourself evaluated. If you're a man and you have a history of using steroids, or for buffing up or in the gym or any other reason, you should actually have yourself evaluated.
Okay.
Yes. So what's the evaluation? A
Yes.
semen analysis.
Okay.
Yes. That's when you ejaculate into a container and the doctor has a look
Okay.
at the sperm to determine the concentration, the shape,
Okay.
the speed
Yes.
at which they're moving,
Okay.
and maybe DNA damage. Yes.
So semen analysis, is it the only test that we do?
It is the first test, but we can also do more evaluations.
Okay.
Typically, a typical consultation starts with medical history
Yes.
about, duration of having children, challenges, that you've had, any treatments, any diseases, etc. Then there will be a physical examination, and then there will be a semen analysis. And based on this, there can be some adjunct hormone tests,
Yes.
ultrasound of the scrotum, some infection screening or genetic testing.
Okay. That's quite a line also. So a semen test is not really a judgment of fertility.
Yes, and that's very true. A 1-point semen test
Yes.
may not exactly tell that you have an issue with fertility, because naturally we have variations
Yes. Yes.
in our semen quality over a period every 3 months.
Yes. Yes.
Maybe lower, or maybe a parameter might be a bit lower or higher. So we have a variation, and that's one of the reasons why we say after 12 months, because the variations may put certain men at quarters where they are not fertile.
So good, yes.
But there are quarters in that year
That they are so good.
where they are so good. So that's why we have that duration of evaluation. So usually when you have an abnormal sperm analysis,
Yes.
doctor will have you have another one within a 60 to 90 day period.
Okay.
After which, if it is also abnormal, then they will actually give you a diagnosis and prescribe necessary therapy.
Okay. So a few myths. Myth or fact? If a man has fathered a child before, he cannot be infertile now. Is that a myth or fact?
That's a myth. A man can be infertile even if he has fathered a child before. Remember, we talked about the causes of infertility for men?
Yes.
Some of them are secondary, not necessarily primary. Yeah.
Okay. So strong erections mean normal fertility?
No? Strong erections mean good sex, but not necessarily fertility. Yes.
Okay. Smoking affects sperm?
That is a fact.
Okay. A muscular man on testosterone may have poor fertility?
That is a fact.
And normal semen analysis guarantees pregnancy?
That's a myth. Okay. Sometimes you may have a normal semen analysis, but deeper down, there are certain tests we can do to find out that actually these sperms are there, but they're not functioning.
And the DNA.
And the DNA damage and inability to fertilize. So the sperm analysis test is one of the first tests that we do, but not the only test.
Okay.
Yes, especially when we find that both of you seem to be normal, but there's still no child in the family. Yeah.
Okay. So basically, having looked, because I've seen also the men, we have quite a number of problems that really affect the fertility. So looking at all these issues, why do men still come late for fertility testing?
It is just part of our social cultural framework. Okay. We are in a patriarchal society. Patriarchal meaning a society run as men are superior. Therefore, men can be responsible for any problem. Men are responsible for glory and owning glory. And because of that, masculinity, that's kind of masculinity is strongly tied to fertility, even though that's a myth, but it is what it is, in our society. As such, and then on the other side of women are blamed for everything wrong. You have a child who has challenges at school. Oh my God, you did not choose the right woman. Anything, any problem, you married a woman who has bad luck. That's why you're being robbed, And because of that, it extrapolates also to issues of childbearing. Because women already bear the burden of the responsibility. They will come to seek care early.
Yes.
Whereas men who do not proportionally bear the burden of responsibility for childbearing will come late or never come.
Never.
And so for most of these men, when they eventually realize they have a problem, they feel shame because of what society expects of a man. They're in denial. They are afraid of being blamed by other men. they have all this conception of cultural idea of what a man is.
Yes.
And then they have pressure from the family, and some of them prefer to be silent. And also, some today out there did not know the things we've just mentioned, that a man actually can have a problem, or what they thought was a representation of their normal fertility was actually not right. And that's why it's important for us to have these kind of conversations, you know, and have people start thinking about it and getting to seek care. Unfortunately, fertility is not something you wear or that is on your face.
Yes.
It's something that is deep down inside. And so you can't look at someone and expect to judge their fertility status. Yeah.
So basically, to the men, they're avoiding seeking help. Basically, doesn't protect the relationship.
It actually just delays help.
That's a good point. So is there hope for men with issues? Is there treatment?
Yeah, there is treatment for many options available. As I said, initially, lifestyle. If the doctor does find that it's lifestyle, that's the problem. Maybe stop smoking. Maybe stop taking excessive alcohol. Maybe, you are having obesity, lose some weight. You're on anabolic steroids for, gym, bathing, stop, all those things. Or you're on kind of gym supplements that, are suspect, stop that immediately.
Okay.
And then we have treating things like STDs or infections quite early. The earlier you treat, the less chance that you have scars in the ducts that conduct your sperm cells, and less likely chance that you have a blockage that will eventually affect your ability to have children. And then some men are born with inability to produce testosterone internally. Those can be put on supplements. Then some other men can have surgery who have, because in men, the scrotum is hanging outside the body to regulate temperature. In addition to that, there are blood vessels that are built special to drain the heat and make sure that it's quite cool where the tests are actually producing sperm. Sometimes those blood vessels enlarge abnormally in what we call varices.
Varicose, yes.
Yes, and those can then eventually cause excessive heat in the sperm production zones, and then you have eventually low production of sperm. So an operation to remove those varices can actually help improve the semen quality, sorry.
Okay.
Then we can actually, for some men, we can retrieve sperm directly from the testes.
Yes.
And then some men, they have just low sperm counts, just alteration in some parameters. We can actually do IVF, in vitro fertilization, to increase the chances of those sperm cells fertilizing eggs.
Yes.
We can do intrauterine insemination, where we also increase the chances in some men to have their sperm cells fertilize the eggs, or we can inject sperm cells directly into the eggs to achieve a conception. So there are options. Of course, there are those cases where there's actually no more sperm production, and there's nothing can be done.
Yes.
And the option is always to do a sperm donation. And I know already we have all this toxic masculinity in a patriarchal society. That comes as a major bomb for most of these men. But with counseling, it's still not something that can be overcome. And I know very many couples that are happy where donor semen was used to achieve a pregnancy.
Okay.
Yes.
So these days we have basically what we call premarital checkups.
Yes.
Some couples have embraced premarital checkups. So on a man's side, as you plan to have a family with your wife, what can be run on the man's side?
I do not want people to be too scared.
Okay.
And I personally believe that love transcends all boundaries.
Yes.
And I am not such a person for conception-related screening, because we have solutions.
Good.
Yeah, we have solutions. So I'm a proponent of genetic screening, of course, like sickle cell. Yeah, those can be quite very challenging.
Yes.
Yeah, but conception-related screening is something that I'm actually not such an advocate for. And so I'll go back to what I mentioned earlier. Try.
Try first.
As I said, the normal semen analysis doesn't mean you have kids. Yes. Yeah, and so just try first, and if things fail, then, because I don't want people to be too scared. And you may have poor parameter today at the test screening, and your wife to be is like, no way,
Okay.
we are not getting married. Then the next quarter, your semen is back to normal,
Yes.
and then you missed out. So I believe, I know there are people who insist, but that's not a guarantee that the marriage will work. Yeah.
Okay.
Yeah.
So another myth: does sexual strength prove fertility?
No. Sexual strength is not correlated with fertility for men or for women.
And does masturbation cause infertility?
No, it does not. In fact, the way in which we produce sperm for analysis or use for treatment is through masturbation. We are not saying masturbation is okay. No. We are only saying that it has its own other psychological challenges that it imposes on people who do it, but it doesn't affect their ability to have children. Yeah.
Frequent sex, does it reduce sperm count?
Yes, but it does not necessarily correlate with infertility. For men who unknowingly have low sperm counts, frequent sex drops them further.
Yes.
And in such men, they may say, we have sex every time, but we don't have children. So in such men, usually we prescribe them to have sex 3 times a week on alternate days to increase their chances.
Okay.
Yeah.
Is watery sperm a sign of infertility?
No. Watery sperm is just sperm. Sorry, watery semen is just watery semen.
Okay.
It has to be analyzed first to know whether they are sperm cells or not. Yeah.
And does penis size have any correlation with fertility?
No, it does not. Penis size doesn't have a correlation with fertility. And I hope men out there who are trying to seek all kinds of therapy for it,
For enlargement?
I hope it's for other reasons, but
Not.
it will not help.
Talk about
there's no
shisha.
other sensitive way of
Yes.
saying it. Yeah.
Smoking shisha.
Shisha. In some people it does affect. And I'm telling you, people don't know what they're putting in those things.
Yes.
Nigga just come. I think that's a blip.
Yes. To Rebecca.
Comes and drops things there. People just smoking. They have no idea what they're smoking. Because I dare someone to tell me that they smoke shisha, but they inquire from the shisha master or shisha attendant, what exactly have you put?
Okay.
They don't. They are so intoxicated to even ask.
Yes.
For God's sake, someone could even be poisoning you. No one knows what they are smoking. All the thing they care about is the flavor of
The shisha.
of
that's
of
coming out.
what's coming out. So let's be very, very cautious.
Okay.
Yes.
So, Doc, quite a good discussion. Your parting remarks.
My parting remarks are: we now know that fertility is not just a woman's responsibility.
Yes.
It's a couple's responsibility, with all members of the couple, female and male, contributing equally.
Equally, yes.
It's not just about masculinity. It's not about confidence
Yes.
or appearance. It's about health, a shared responsibility.
Yes.
The earlier men get involved, the better the journey for them as a couple.
Yes.
And I'll say, men should really know about their fertility. If you fit within the category of what I described, 12 months, no child. 6 months, something you suspect, no child. Go with your partner to have yourself checked. There might be a problem. There might even be no problem. And as you said, it's just your frequency of sex. Either low or extremely too frequent.
Too frequent, yes.
Either way, you get help. At the end of the day, we are put on this world to procreate. You cannot fight that natural urge. So let's seek help. Let's take responsibility.
And there is help for everyone.
There's hope for everyone. There's a solution for every man out there with the challenge.
Thank you so much. Dr. Kaira has given us quite a good insight on male infertility. Dr. Kaira is an embryologist, Oxford trained, one of the best in the country. And we're always glad to have him on these conversations. We hope this enlightens and helps the couples out there. Whoever is facing a problem, be it the female, be it the man, please seek help. Like he has said, there is treatment for everyone. Thank you very much. See you next time.